Dr. Eric Osansky, welcome to Women's Wellness Radio.
Thank you. Thank you, Bridget. Thank you for having me.
Thanks for being here. So just a quick bit about your background. You're a chiropractic physician. You've got a master's in nutrition. You're certified by the Institute of Functional Medicine, and you yourself have your own thyroid story. I wonder if you could share a bit about your story and also, how that evolved your career.
Of course. So I was diagnosed with Graves' disease, which is an autoimmune hyperthyroid condition. And most people, when it comes to thyroid health, more people have hypothyroidism and Hashimoto's. Not as many people have Graves' disease and hyperthyroidism. But I was diagnosed with Graves', and I knew from the start I was going to take a natural treatment approach. Honestly, wasn't too familiar with Graves' at the time, but did my research. And even before then, I, attended some natural endocrinology conferences, and that's how I knew I was going to do things more naturally. But honestly, I wasn't sure if the natural treatments would work. So I was honestly somewhat skeptical, but still didn't want the alternatives are taking anti-thyroid medication for a prolonged period of time, or radioactive iodine, or thyroid surgery. But long story short, I once again took a natural approach. I personally avoided the medication. Not everybody's able to do that, but I was able to not be on the medication and manage my symptoms through supplements and herbs. Made a lot of lifestyle changes, dietary changes. Of course, took some supplements, and eventually went into remission. And from that point forward, was able to maintain and still able to maintain my health. And, shortly after getting into remission, and probably even while I was getting to remission, I just had this idea that there's a lot of people out there with similar conditions. And so I started helping people with hyperthyroidism, Graves' disease. And of course, there's a lot more people with hypothyroidism and Hashimoto. So I also started helping people with those conditions as well.
And were you more of a hands-on kind of sports chiropractor in the beginning?
Yeah, I don't know if you'd say sports chiropractor. I was definitely hands-on. I had a typical chiropractic practice, and dealt with typical chiropractic conditions, neck and back pain. Even though chiropractors do a lot more than that, they're associated with neck and back pain, But yes, my practice was 100% in person, because it's very difficult to adjust people remotely in chiropractic. So unlike here, my current practice, I deal with a lot of people remotely. But yes, to answer your question, was pretty much hands-on, and I did deal with some sports injuries and some extremities. But yeah, I had pretty much a traditional chiropractic practice.
Okay, yeah, it's a big evolution for sure. So you mentioned briefly that there's more hypothyroidism than hyperthyroidism. I do see some hyperthyroidism, but definitely, like you said, more hypothyroidism. I wonder if you could talk a little bit about those two labels. And I don't know if this is a question that can be answered, but when or why someone would tend to one or the other.
Yeah, well, so hyperthyroidism, or I guess we could start with hypothyroidism, since that's the more common one. So hypothyroidism is, associated with low thyroid hormone levels. And typically you see, I don't know how deep you want me to get into, as far as testing, but on a blood test, you would see low thyroid hormones, typically like a low free T3, free T4, and then there's thyroid stimulating hormone, which is a pituitary hormone. You usually see that on the higher side. And with hypothyroidism, due to the low thyroid hormone, it's common to get symptoms such as fatigue, weight gain, brain fog, hair loss. There's many different symptoms, but with hyperthyroidism, it's the opposite. You have the elevated thyroid hormone levels, and on a blood test that would present with elevated thyroid hormone levels, like a high free T3, high free T4. The TSH typically is undetectable, and symptoms would, like when I was dealing with Graves' disease, hyperthyroidism, some of my symptoms were elevated pulse rate, heart palpitations, I had a good amount of weight loss, lost over 40 pounds, and increased appetite, increased bowel movements are common. Some people have what's called thyroid eye disease, where the immune system attacks the tissues of the eyes. And as far as why someone develops hypo compared to hyper, I mean, I don't think we know all of the answers, but I mean, genetics definitely plays a role with when it comes to, not just hyperthyroidism and hypothyroidism, but well, I should also say that most cases of hyperthyroidism and hypothyroidism are autoimmune. So most people with hypothyroidism have Hashimoto's thyroiditis, whereas most people with hyperthyroidism, they have Graves' disease. And again, genetics does play a role in not only who develops Hashimoto's and Graves, but also other autoimmune conditions as well. And, so that's a brief summary of the difference between hyperthyroidism and hypothyroidism and Hashimoto's and Graves.
And I'm curious, in your case, Eric, how long were symptoms going on before you got a diagnosis?
Symptoms aren't going on too long, and that's what I think one of the things also that differentiates hyperthyroidism from hypothyroidism is that with hypothyroidism, especially with Hashimoto's, people typically there's a few different stages of autoimmunity. So, and I'm not going to get into detail with the different stages, but with one of the stages, with the earlier stages, you could have thyroid antibodies, initially without any symptoms, but for years, you could have normal thyroid hormone levels, normal TSH levels, yet start presenting with some of the symptoms of hypothyroidism. When someone has Hashimoto's, I mean, I'm sure you've seen this where, everything might look normal in a blood test, yet someone is, experiencing fatigue and other thyroid symptoms, weight gain, again, the brain fog. With hyperthyroidism though, what I see is that it's more, how can I put it, more fast acting, like the symptoms, unlike Hashimoto's where you could have hypothyroid symptoms for 5, sometimes even 10 years before officially being diagnosed. In most cases with hyperthyroidism and Graves' disease, you'll find, I mean, the symptoms are hard to ignore. Like if someone, for example, is having hypothyroidism and they're having weight gain or fatigue, a lot of people will blow that off. Maybe it's due to work, the fatigue, or, as far as weight gain, maybe it's related to diet. I mean, there's so many different factors that can cause fatigue or weight gain. But when someone is having an elevated heart rate, and is losing a lot of weight and is having heart palpitations, I mean, it's also scary, like when I was dealing with those symptoms initially, coincidentally, I was dieting and detoxifying. So I was losing weight and I was attributing those symptoms, especially the weight loss and increased appetite. I was attributing it to the diet and to the detoxification. So I wasn't really putting 2 and 2 together. But then one day I was walking around in a retail store, actually a Sam's Club, a number of years ago, and there was an automated blood pressure machine, and I took my blood pressure, which was normal, but my heart rate was elevated, which it normally isn't. So that kind of, had me putting the pieces of the puzzle together. Because after that, I went home, checked my heart rate. The next few days was, religiously checking my heart rate, and it was consistently elevated. And then finally, I went to a medical doctor, got diagnosed with hyperthyroidism. So in my case, it was probably a few months. It definitely wasn't a few years as far as myself experiencing the symptoms. Probably, I'd say like 3, 4, 5 months before I actually went to the medical doctor, got diagnosed with hyperthyroidism. And then a few months later, I saw an endocrinologist, and that's when I was diagnosed officially with Graves' disease.
Yeah, I want to dig into both of those points a little deeper. First one being, do you feel like Graves or hyperthyroidism gets diagnosed easier in the conventional community because it is so like fast acting and has these key symptoms, whereas Hashimoto's with the weight gain, and this could be a lot of things, right, causing weight gain or low energy. So do you think that Graves gets caught or hyperthyroidism, I'll start with that, can get caught quicker conventionally?
Oh, definitely, without question. And one reason why, it's not just the symptoms, but the blood test too. So like again, Hashimoto's, the problem is a lot of medical doctors, most medical doctors won't test the antibodies. They're going to just start with the thyroid panel. And if the thyroid panel looks good, which is another story too, because it might look good according to the reference range, but it's not optimal. But so if the TSH, thyroid hormone levels are within the lab reference range, even if they're not optimal, many medical doctors will say that it looks fine, and most patients don't know. Most people don't know any better. They're just taking the word for their medical doctor. But with hyperthyroidism, typically the blood test, again, it's going to affect the blood test a lot quicker than with hypothyroidism is what I see. So by the time someone's presenting with elevated heart rate, palpitations, weight loss, they're going to have elevated thyroid hormone levels and a depressed TSH. And as soon as a medical doctor sees that, the person's going to be diagnosed with hyperthyroidism. And then it's just a matter of, usually doing a few other tests just to see if the person has Graves' disease.
Okay. So yeah, it sounds like the first time you got tested, they did not test the antibodies for you either. And then
Correct.
You got them tested later. Okay.
Correct.
Yeah. Good to know about. Yeah. I think our audience is a little aware of the antibodies issue, but when I go to talk to potential clients, still many are like, no, I haven't my antibodies tested or last time I had my thyroid checked was 3 years ago and everyone said it was fine. So I think there's an education happening in my community and communities like this that there needs to be deeper testing, but sometimes it's a matter of like, well, who can test me or who can, we can talk about your your practice later, but it's true that you need a practitioner who's sort of on board with it all, because you can ask them to do deeper testing, but if they don't really know what to do with the results, or if they say, oh, well, everything looks in range. Then
plus also the type, like when it comes to Hashimoto's, for example, sometimes I'll see, a patient that has one antibody tested. So for example, they might have the thyroid peroxidase antibodies tested and maybe that's negative, but they never had the thyroid globulin antibodies. And it is, I'm sure you've seen where one antibody is negative and the other is positive. I mean, a lot of times you'll see both positive, but that's not always the case. So that's also, as you mentioned, you want to see someone who knows what they're doing and not just looking at one antibody. Same thing with Graves. With Graves, it's thyroid stimulating immunoglobulins, but I've had numerous patients over the years where they're getting the Hashimoto's antibodies tested and not the Graves antibodies, even though they,
Yeah, I don't know if you agree with this, but one fellow practitioner said she sometimes sees the thyroid globulin antibodies happen first before the TPO. And do you ever see that progression?
I guess I've never really paid attention to the pattern because usually initially when doing a test, I'll test for both of them. And I mean, there are times when I'll see thyroid globulin elevated and thyroid peroxidase, normal, for example, and I don't always just go by one test. So I will in the future do repeat tests. And I can't say there haven't been cases where, later on, maybe the thyroid peroxidase elevated, but I've seen so many different patterns too. I've seen, all different types of I mean, not that there's a ton of different antibodies, but I've seen, I've seen where both of them are negative, and then a few months later, both of them are positive. So I can't say that I've seen like a set pattern where thyroid globulin antibodies are positive, and then a few months later, the thyroid peroxidase antibodies, which were negative, are now positive. So it is, I guess that is possible. I just haven't seen that.
Yeah, it's fine. I mean, hopefully I didn't manifest it, but I started with a very low thyroid globulin antibody. And I was like, what's to make of this? Because that's kind of the less frequent one. And my friend said, oh, well, sometimes, that comes first. And sure enough, I added in the TPO. It was quite a while later, maybe a year later, they added, that one added in. So hopefully I didn't bring that with my mindset. So your specialty is natural solutions, and you said earlier not everyone can avoid them, or avoid conventional treatment, which I think is good of you to say, right? Because there is all sorts of cases. Some cases are caught quite late, or very severe, or you're pregnant, or whatnot. But so let's talk about the natural solutions. Let's start out with the diet you recommend.
Sure. Well, with the diet, once again, most of my patients and just most people in general with both hypothyroidism and hyperthyroidism are autoimmune. So in most cases, I will recommend an autoimmune paleo diet, at least as a starting point. I mean, what I've learned about diet is that there's no perfect diet that fits everybody, or no specific diet that fits everyone perfectly. I mean, autoimmune paleo diet to me is just a starting point. And it really, depends on the person. If there's someone, I was going to say if someone's not autoimmune, which again, just as we mentioned, maybe they just have negative antibodies. You can't just go by antibodies. But if I'm suspecting someone's not autoimmune, do they need to follow an autoimmune paleo diet? Maybe the person, might just be okay with a standard paleo diet. But, and do you want me to, I don't know if you want me to talk at all about autoimmune paleo, or if most of your listeners are.
Yeah, maybe you can just kind of say the purpose of it. We do have an episode on it that I could link back to. I'd especially just like you to talk about the purpose of it. Because I think if we talk about all the foods they can't eat, it's kind of starts out as like depressing. But it does have a really good aim in mind.
Yeah, well, and to me, an autoimmune paleo diet also serves as an elimination diet. So, so one reason behind the autoimmune paleo diet is to avoid those allergenic foods. So you're avoiding, gluten, you're avoiding dairy, you're avoiding eggs. Pretty much anything that's a food allergen. Of course, people could be allergic to healthier foods. I've seen people allergic to or sensitive to broccoli and other foods, but for the most part, you're avoiding the common allergens. And then a big rationale behind the autoimmune paleo diet is to avoid those foods that could have a negative impact on gut healing. Certain foods such as eggs. Eggs isn't, not only can eggs be a common allergen, but also the egg whites have some compounds which can affect healing of the gut. Nightshades such as tomatoes, eggplant, peppers, white potatoes, they also have some compounds that could affect gut permeability, cause inflammation. Doesn't mean everybody has a problem eating eggs, has a problem eating nightshades. In fact, when it comes to reintroducing foods, one of the first foods I usually have people reintroduce are eggs, just because they're nutrient dense. And if someone's a vegan, of course, with a completely different story. But pretty much eggs will be the first one I reintroduce. And, that's the purpose of the autoimmune paleo diet, is really just to avoid those foods that a person will be allergic to or sensitive to, and then also try to avoid those foods that could affect healing of the gut. And the reason that's important is because there is a theory, according to the three-legged stool of autoimmunity. There's three components. One is genetics, one is an environmental trigger, but then a third is supposedly everybody has a leaky gut. So that's why a big focus with any autoimmune condition is on gut healing.
Yeah, I want to share a little funny story I had last week. Was I did a supplement consult with a person. It's not like a long-term thing, but we were chatting about our supplements and going over them. She's having this hand pain, kind of like arthritis, and she's very worried about it. And she eats really well, takes a bunch of supplements, but then she kind of just casually mentioned at the end how the same thing she has for lunch every day, which is basically a bunch of nightshades, like peppers, eggplant, tomato. And I was like, oh, I'm really glad you mentioned that. So let's take those out. I guess historically they hadn't always bothered her, but eating them, especially every day, might be a bad combination. It's funny. It's often the things, right under our nose that are bothering us, right?
Yeah, no, you're right. Yeah. And again, not everybody, I've had people that reintroduce nightshades and it's not a problem, but there are people that that reintroduce them and don't do well. And then, of course, there's people who aren't compliant and won't, they won't give up their tomatoes or won't give up certain foods. And, again, it comes down to everybody's different, but the problem is we don't know how people are going to react. That's why initially, even those doctors who don't recommend autoimmune paleo, a lot of doctors will, put someone on an elimination diet just, for that same purpose.
Yeah. So you got an interesting point you sent me here, which is, what if someone has antibodies for Hashimoto's and Graves' disease? I actually don't know much about that point. What is your approach if someone has both?
Yeah, well, of course, they're both autoimmune conditions, and really the treatment itself, for Graves and Hashimoto's, I mean, there are some differences, but the big differences is in the management of the symptoms. So if someone is presenting, and this isn't uncommon, I'll see someone that probably more common with someone seeing me with Graves' disease, and they have, also Hashimoto's antibodies. So if that situation, if they're presenting with hyperthyroid symptoms, then at least from a symptom management standpoint, we're going to do things to help with, whether it's anti-thyroid medication. I mentioned before, some people do need the medication, but, then there's also the herbal option. But either way, if they have hyperthyroidism, we want to manage the symptoms, and then, of course, try to find out what's triggering the autoimmune response, try to find out what imbalances. So, looking at different areas, the adrenals, the gut. And same concept with hypothyroidism. So if someone, presents with Hashimoto's, or should I say, if they're presenting with the antibodies for Hashimoto's and Graves, but their symptoms are more hypothyroid, and maybe their labs are more hypothyroid, so we're seeing either low or depressed thyroid hormone levels, an elevated TSH level, then same thing. In that concept, they might need to take thyroid hormone medication. But whatever option they choose for symptom management, we're going to treat the person's hypothyroid symptoms. Obviously, in that case, we wouldn't want to give them, even though they have the antibodies for Graves, we wouldn't want to give them anti-thyroid medication or bugleweed, which is an anti-thyroid herb. Yeah, we wouldn't want to give that to further lower the thyroid hormone level. So the symptom management will depend on the symptoms, of course. The symptom management will depend on, not only the symptoms, but the presentation. So, again, on the labs, if they're hypo, anyway. But then the immune system, that there's a lot of overlap. So just, now there might be different triggers with Graves and Hashimoto's, and there's some of the same triggers as well. But either way, the goal is to play some detective work, in my case and in many other healthcare professionals' cases, and probably yours as well. I mean, some testing usually is indicated. Of course, health history is important, and some rely more on the health history, others rely more on testing. But really, to get back to the question, if someone has the antibodies for both, then the focus is still going to be on the immune system. So again, that's really not going to change much, but the main difference is, again, in the management of the symptoms, depending on how they're presenting.
So to sum that up a bit, treat the symptoms because the person's going through stuff, which is, so they need some support. Meanwhile, you identify the root causes, treat the root causes, which takes some time, right?
Exactly. So yeah, I mean, pretty much you're going to manage the symptoms while addressing the cause. So yeah, you said it perfectly.
So I do want to ask more about, you said focus on the immune system. So tell us more about how that's accomplished.
Sure. Well, you want to try to find out, since, with Graves' disease and Hashimoto's thyroiditis, they're not thyroid conditions, but they're immune system conditions that affect the thyroid gland. So again, from a symptom management perspective, we mentioned how, we might want to take thyroid medication, but as we also want to find out what's causing, what's triggering that autoimmune response. So I mentioned before the three-legged stool of autoimmunity, also known as a triad of autoimmunity. And, so one component is genetics, which we can't do anything about. But Oh, I shouldn't say that. I mean, we can modify the expression of genes, but we're not going to really change the genes. If someone has a genetic marker for Graves or Hashimoto's, that won't be changed. But, the environmental trigger, we want to find out, try to find out what the environmental trigger is that's causing the autoimmune response. And then we also want to heal the gut, because if someone, if we don't heal the gut, then, they're not going to, in order to have a healthy immune system, you need to have a healthy gut. So, you need to have healthy adrenals in order to have a healthy gut, healthy adrenals in order to have a healthy immune system, healthy gut to have a healthy immune system. So those are going to be some of the areas that I, like adrenal testing I do on pretty much everybody. I don't do stool panels on everybody, but some healthcare professionals do. And the justification is because in order to, like I just said, in order to have a healthy immune system, you need to have a healthy gut. But, really initially the big thing you want to do is try to identify the trigger, remove the trigger. So, if it's gluten, for example, we want to, make sure the person's not eating gluten. If it's an infection, we want to try to identify the infection and remove the infection.
So mainly the way is take the stress off the immune system that's making it misfire and kind of overact on our own tissue. Do you do any of that kind of, TH1, TH2 regulation? I was just reading an article about, what's it called? Low dose naltrexone. Is that what it's called? The other day. Do you play around with any of that stuff?
Yeah, well, TH1. So these days, I don't see as many doctors using, we'll talk about LDN in a minute, but with TH1, TH2, so the basis behind that is that Hashimoto's is considered, in most cases, to be a TH1 dominant condition, for example. And so some doctors will have someone take certain nutrients or herbs to help shift them more towards a TH2 profile, balance that TH1, TH2 pathway. I don't personally take that approach, and I don't test for cytokines, but now I think what a lot of doctors are looking at more than not that they're ignoring TH1, TH2, but they're looking more with autoimmunity TH17. You see an increase in TH17 cells and a decrease in what's called regulatory T cells. So what I focus on are nutrients and herbs that help to decrease TH17, increase regulatory T cells. Low dose naltrexone, still not everything is known about it because it's not just for autoimmunity, but a lot of people with autoimmune conditions now do take low dose naltrexone, and supposedly that's supposed to help. One of the mechanisms is by increasing regulatory T cells, which helps to suppress the autoimmune response. So I can't personally prescribe LDN, but there are times when I will recommend, for a patient to take LDN. I guess the downside, it's not doing anything for the cause of the problem, but it is modulating the immune system and can help to, get the symptoms under control while we are trying to address the cause of the problem.
Okay. Yeah, I was just curious. When I was sick, a lot of people on the podcast heard me blah, blah, blah. But I told you earlier, I had mold toxicity. And I think from that, in my opinion, some thyroid came up. And there was a point where I was, I really struggled with just feeling like flu-like symptoms and sick a lot. And I was messing around, so to speak, with this TH1, TH2, which I should explain are kind of like branches of the immune system, like different modes of the immune system. And there's certain foods that support some versus the other, certain herbs. But I found it a little bit tricky to figure it all out. Like when I was younger, so to speak, some years back, astragalus and echinacea really helped me through the winter. But when I was taking it now, I thought, maybe it's making it worse. So kind of now I'm learning like things like fish oil or turmeric. It's more just like regulating. So you're not having to identify one branch or the other as being dominant, which is kind of sounds like a little bit like your approach as well.
Yeah. Well, that you're probably, a number of your listeners probably are familiar with Dr. Datis Karazian. Are you familiar?
Yeah.
So he used to focus a lot on TH1, TH2. And from what I understand, just a lot of when I attend conferences, I don't know if I won't name any names as far as like companies, but like some of the conferences where he provides the material, they don't talk as much about balancing TH1, TH2, but just like you said, they talk about,
Anymore.
yeah, they
Okay.
talk more about like curcumin, resveratrol, vitamin D, fish oils, just using things to, increase those regulatory T cells and decrease the TH17. So I'm not saying that doctors don't use TH1, TH2 balancing techniques as far as foods and herbs, but I just don't hear about, usually it's more about increasing the regulatory T cells, decreasing TH17. But of course, if someone with Hashimoto's, for example, like one of the controversies you mentioned, echinacea, which is supposedly stimulates TH1, the TH1 pathway. And again, there's arguments either way. Some will say, no, I give everybody with Hashimoto's echinacea and they do fine. But either way, you need to listen to your body. So if you are taking anything, whether it's echinacea and I like echinacea, so I'm not picking on echinacea in any era, but just giving that as an example. But point is, just listen to what your body says. So and yeah, I'll leave it at that.
I think that's a good summary. And I'm kind of digging a little deeper so we can get a little deeper for people who are looking for kind of theories and treatment modalities. Yeah, I think, like I said, when I was at an earlier point in my life, it felt really good to me. And probably when I was getting a lot of flu-like symptoms again, I started taking it again. It wasn't a fit for me anymore. Maybe pushing this TH1 pathway that I didn't need. Who knows for sure, but yeah, it's interesting stuff. So I think we've covered this to some extent, but maybe we can dive a little deeper. So many clients, I'm sure many of yours as well, they have been to a conventional doctor, may have come out with no diagnosis, inadequate testing run, or maybe they did get a diagnosis at least of hypothyroidism, and they're given Synthroid or something. I don't think I've ever seen a doctor go beyond that in a conventional space. Do you want to talk more about doctors and endocrinologists and kind of their approach?
Sure. Well, I mean, it comes down to their training. Unfortunately, that's usually the extent of their training when it comes to, with Hashimoto's, for example. Even though they know it's an immune system condition, they don't know what to do to help with the autoimmune response. And, even though it's, I won't say common sense, but, as far as diet and, doing things from a lifestyle perspective, we know, everybody knows that eating well plays an important role in our overall health. And, yet, even that, it's fine if they want to give Synthroid. That's obviously not the best option in my opinion, and your opinion, but they don't do anything from a lifestyle standpoint. But yeah, I mentioned earlier, some people need thyroid hormone medication. So if they're going to give thyroid hormone medication, I guess there's better options than Synthroid. If you're going to give medication, like I do like natural thyroid hormones desiccated, such as Nature-Throid or WP Thyroid. And again, it's not saying that's a perfect fit for everyone. But even if someone needs synthetic T4, let's say they don't do well with desiccated thyroid, there's Tyrosint, which is a more hypoallergenic form of T4 and doesn't have all the fillers and artificial ingredients as Synthroid. There's, with regards to medication, there's obviously different options than Synthroid, but then also, just not doing anything for the health of the immune system. Some of that's changing. We are seeing some medical doctors practicing functional medicine, like Institute for Functional Medicine, which is taught by a good amount of our medical doctors, not all of them, but again, fortunately, there are medical doctors that have an open mind, but most conventional medical doctors and most endocrinologists, very rarely do I see an endocrinologist who is open to doing things, to help improve the immune system, whether it's through diet or supplementation. And in some cases, probably more so with Graves' disease than Hashimoto's, just because Graves' disease, I think they're more concerned about the person with the elevated heart rate and palpitations. But I've seen some endocrinologists where they pretty much fire the patients. They tell the patient, if you're not going to follow my recommendations, then, I don't want you as a patient. And And some patients, they want, they don't want to stop seeing the endocrinologist. They just want to do things, they want to work. If the endocrinologist is going to help them, then, they're fine seeing the endocrinologist if they need medication or blood work, blood orders. But, they also want to work with someone else that can help them address the cause of the problem. And, some endocrinologists are fine with it. I mean, some, I guess you could say, will tolerate them, but, a lot of endocrinologists do become defensive. And, I don't think it's anything, I sincerely think that most endocrinologists and other medical doctors want to help people. They just really don't understand what we're trying to do. And once again, I think it comes down to their training.
Yeah, and I realize after I probably put my foot in my mouth. There are medical doctors who are doing a more integrative approach or more forward thinking. I think it can be time that they get with you is a problem, time to study. They're seeing a lot of people. And then, it takes a long time for something to be adopted mainstream. So often you'll hear, that there's not enough study behind that. And which isn't always true. There's actually a lot of study done on a lot of natural supplements. But it's creeping in. I do see a lot of doctors test vitamin D and recommend vitamin D. I think that's fantastic. That can do a lot for the body. You mentioned earlier, I think bugleweed for, did you say hypothyroid?
For hyper, like Graves' disease, hypothyroidism.
Okay. Just curious if, and we won't go too deep because we're not recommending people run out and buy this stuff. You work with a practitioner, but are there other natural substances you found to work really well?
Well, for hyperthyroidism, again, when I was dealing with hyper and Graves, I took bugleweed. Typically for hyperthyroidism, antithyroid medication such as methimazole is what's commonly recommended. So I took bugleweed. And then there are others. I mean, that's probably the best antithyroid herb out there. Motherwort is used to help manage the symptoms, like cardiac symptoms. And then, there's lemon balm, which has a calming effect and some antithyroid activity. When it comes to, and there's a few others, L-carnitine, potentially. There are actually some research, you mentioned studies, L-carnitine, which might freak out some people with hypothyroidism who take acetyl L-carnitine, but in very higher doses, it potentially could have antithyroid activity. So if you're taking a few thousand, especially 3,000-4,000 milligrams per day of the L-carnitine. But with hypothyroidism, so I will say that there's no substitute for thyroid hormone. There's no, with hyperthyroidism, I mentioned that I was able to manage my symptoms by taking the bugleweed instead of the medication. With hypothyroidism, it's a little bit of a different situation because, with thyroid, it's a hormone. It's not, if someone's low in the hormone, now you could take, depending on the situation, there's nutrients that might be causing the thyroid hormone deficiency. So if someone doesn't have Hashimoto's, maybe they have, the controversial iodine might be low, or maybe tyrosine, is, that also is important for thyroid hormone production. There's some herbs that can potentially stimulate thyroid hormone production, like ashwagandha is known for its effects on the adrenals, but also can potentially affect the HPT axis, which is the hypothalamic pituitary thyroid axis. But quite frankly, rarely do I see those being effective, and especially not really being a substitute. So if someone, has low or especially depressed thyroid hormone levels, in most cases, they will need to take thyroid hormone medication, at the very least, while we're trying to address the cause. It doesn't mean everybody will need to be on those permanently. Some people will. Some people need to take thyroid hormone forever. Other people, as the health of their immune system improves, depending on how much damage is done to the thyroid gland, they might be able to wean off or maybe not take as high of a dose. So it really is dependent on the person. But with hypothyroidism, the only thing I will say that might be a substitute, and I've done this with some patients, let's say if they don't want to take Synthroid, and that's all the doctor's recommending, and they're finding out, and they're having a hard time getting prescription for Nature-Throid or Armour or a desiccated thyroid hormone. And since I can't write prescriptions for desiccated thyroid hormone, I might give them a thyroid glandular. There are some thyroid glandulars out there that do have some thyroid hormone. And, so that can potentially be a substitute.
Okay. No, it's good.
Yeah.
It's good to be honest because your clinical experience is really valuable. And yeah, sometimes it's just like what's going to make you feel better, what's going to get you through the day. And it's not like the worst thing if your body really needs the hormone and it just can't, produce enough of it. Yeah.
And I'm not big into jumping to hormones either. Like I'm of the mindset is, try to restore health. And if the person needs the hormone, they need the hormone, whether it's thyroid hormone or if someone, has a hysterectomy, they might need to take, some bioidentical hormones, but, I'm not big into jumping into the hormones. But if someone needs it, again, if someone has Hashimoto's, for example, and they're, we do a blood test and they're free T3, free T4, both are not only low, but depressed, very low. And again, in my experience, that person probably needs to take thyroid hormone, even if it is on a temporary basis. And again, sometimes it is on a long-term basis, but again, or like I said, maybe a glandular could help as well that has thyroid hormone, but usually taking something like ashwagandha, for example, in that case, or tyrosine, or, a supplement that has like, tyrosine, iodine, like a bunch of, again, usually in my experience, that's not going to, do the job in that case. So.
Okay.
Yeah.
So Eric, let's talk about your resources, how people can find you. You mentioned you work online, like, how can people start to work with you?
Yeah. Well, probably the best thing people could do is visit my website, which is naturalendocrinesolutions.com. And you could, those when you visit, you could sign up. I do offer like a free guide that, gives like an introduction to helping people.
Don't you have like some super long ebook?
Yeah, yeah. I guess you call it an ebook, but it's called a guide, but guide ebook. So
I remember seeing that and like thinking that looked pretty cool.
Yeah, and then I also have a book. I've written a book on hyperthyroidism and Graves' disease. I am currently working on one for Hashimoto's as well, so hopefully that will be out soon. But right now there is one out for hyperthyroidism, Graves, and I wrote that first just because of my personal experience, and there's not as many books out for people with hyperthyroidism. But
that's true.
Yeah, so those probably would be the two best, my website, and then also I do have a Facebook page, as most people do these days. So that's another option, I guess, is to visit the Facebook page. But yeah, I would.
And then if people want to work with you or interested in working with you, they just use you have a contact form page? Is that how
probably the best thing to do? So what I recommend for everyone before becoming a patient is to, we offer free webinars. I put together a few free webinars just to really educate them and to let them know.
Gotcha.
Yeah,
Okay.
just to give them an idea, not only of what a natural treatment approach would entail, but also just to give them an idea of like what working with me would involve. So yeah, what I would do is if you visit the website, or you could call our office, which again, the contact information is on the website. So you could call, email our office, but yeah, I would recommend watching the free webinar first, and that'll pretty much tell you what you need to do in order to set up a consultation.
Okay, awesome. Yeah, thank you. Any other things you want to sum up or anything we missed?
Well, I mean, I guess just, and again, most of your listeners probably are aware of this, if not before this, interview, but now is, again, just there is hope. And if you have, whether it's hyperthyroidism, whether you have hypothyroidism, Graves' disease, Hashimoto's, just remember it is an immune system condition. And while you might need to do things to help support the thyroid gland, you definitely want to focus on the immune system. And, if you can't, if you're working with the doctor, medical doctor, endocrinologist, if they're not providing the care that you need, at least from a natural perspective, then, don't be afraid to look elsewhere, whether it's me or others, besides myself, there's plenty of other doctors who focus on, endocrine conditions, thyroid, autoimmune conditions. So again, there's definitely no shortage out there of help. It's just, again, might take take some, visiting some websites. But anyways, I would say point is just, just definitely focus on improving your immune system health. And a lot of it you can do on your own, just through diet, lifestyle. So, I mean, if anything, definitely start by making some dietary changes, do things for stress management, try to get sleep at night.
I would encourage people, though, if you are doing the diet and you're trying to sleep and you're pretty well educated and you're still not feeling better, do please dig deeper with a practitioner, because it is often, I think that the diet is most accessible to the public, and it's great but I meet a lot of people, you probably do too, are on a very restrictive diet, and maybe they felt a little better, but it's not enough better, and they just keep taking more things out of their diet.
Oh yeah, no, I agree. I mean, there's every success story that you read on, in a Facebook group or forum, like you'll hear someone who eliminated gluten alone and, the antibodies decreased and they're feeling a lot better. There's a lot of people who, as you mentioned, I'll see people who have been not only gluten-free for, like 6 months or for even a few years, but people who have been autoimmune paleo diet, for following that for a number of months. And so diet is one potential trigger, but yeah, you're right. You're absolutely right. If you're making dietary changes, and regardless whether you feel better or not, I mean, autoimmunity is pretty complex. If you have Graves or Hashimoto's, I don't recommend self-treating. I do recommend, even if you're making lifestyle changes on your own, to work with a healthcare practitioner.
Yeah, it's complicated. I had studied Hashimoto's and was pretty upset when I first saw some antibodies in me, even though it was super low. I was just like, oh no, but then I think I just kind of like really flipped that. And I was like, I have this because of other factors. And when I clean those up, I feel pretty good that this will go away, and I still feel that way. So I don't really go around saying, I literally never go around saying I have Hashimoto's. I just feel like I have some passing antibodies that I'm going to get on top of, and it feels much better that way, and I'm not trying to live in denial. Like, I'm still going to test myself and track how things are going. But if it is a condition that's basically about root causes disrupting your immune system, you just focus on those. Don't focus on the label so much, I think.
Yeah. And again, it's not even one more thing too, when working with the health, I mean, it's challenging enough self-treating your own condition, but, even when working with a healthcare practitioner, you want to give them some time as well. This isn't something where it's going to be a quick cure. Sometimes the trigger is found right away. Sometimes it does take some time. So
That's true.
So you do need to be, in some cases, patient, because I do have some people who jump around and see, multiple doctors in a very short amount of time and really not giving someone, a good chance. And, so.
Yeah, I mean, it is and it isn't the doctor. Like, I think it's easy to get excited about some new person that you read about. And if you're really just not satisfied with your doctor, it's one thing. But, I saw that when I was doing fertility quite a bit too. It's emotional. It can be frustrating when you're not feeling well. But it's a process. You got even if you find out a lot of things right away, it's still slow going.
Yeah. And you are right. Sometimes it's just not a good fit. So if you're speaking with someone, working with someone, and you just get that feeling that, well, this doctor's not for you, then I'm not suggesting to continue working. But, just if you, do work with someone and you do feel it's a good fit, but it's taking, not, again, you just need to give it a little bit more, a little bit of time, I should say. It's, as far as more time, it depends. If someone's working with someone for a year or two and they're not getting results, then, it's one thing. But if someone is working with a healthcare professional for 2 months and, they're disappointed because their antibodies haven't normalized, then, that's a little bit unrealistic as far as the expectations. And, I think, to be fair, most people aren't expecting that. As you mentioned, most people are, people, whether they have hyper or hypo, when you're feeling bad, you want to get relief. And honestly, even though it's going to take, for those who get into remission, it takes time to accomplish that, but it doesn't mean it should take a long time to feel better. I mean, with most healthcare professionals, you should notice some improvement within the first few months.
Yeah, some little by little. And, I think it's great to bring ideas to your practitioner. There's a couple of people I've interviewed on the show who are experts in this or that, and they're like, I became an expert in this because my clients came to me and said, could you look into this? And I really, really admire that. I really admire a practitioner who, has someone in front of them who's sick and isn't feeling better and comes and say, could I have this Marcon's infection in my nose? Could I have Lyme disease? And instead of dismissing them, to say, you know what, let me look into that. I think that's really great. So if you have a practitioner, you're reading something, bring that to bring that to your practitioner and give them a chance to look into it, and hopefully they will.
I agree. And a good practitioner, if they can handle it, like I'll do research on my own, but I also know there are some things I can handle, and there are times when I will refer someone out. So if they're a good practitioner will know, when there's, if there's another expert, like you mentioned, mold, toxic mold, chronic inflammatory response syndrome. That's, again, not all practitioners handle that. And, so again, there's nothing wrong with them doing research and, trying to help the person, but then, there's people who deal with that on a regular basis, practitioners who deal with that, on an everyday basis. And, so if the practitioner doesn't feel comfortable working with a certain condition, there's nothing wrong with them saying, of course, if the person is coming to see them for that condition, it's one thing. So, but if someone comes to see, if you're working with someone that has, if you're seeing a practitioner, someone with Hashimoto sees a functional medicine doctor, and the functional medicine doctor accepts that person because they have Hashimoto's, but then later finds out that they have chronic inflammatory response syndrome, in my opinion, there's nothing wrong with referring that patient out if that practitioner doesn't have experience dealing with the, or Lyme disease. Chronic Lyme disease is another example that could be very complex. And if, the person is diagnosed with chronic Lyme disease and the practitioner doesn't have a lot of experience, they might refer them to someone who deals with Lyme disease on a, daily basis. And, so again, I agree with you that, and, you want, as a practitioner, I'm always doing research and I'm always learning new things, but you also need to know your limitations as well.
Yeah, I totally agree. There's a few things where I'm like, I will co-treat on your case, but I cannot. And Lyme is one of them. I'm like, I'm trying. That's a really complicated condition. And I'm just getting started. So yeah, I think that's healthy too. Some practitioners will just try to come up with a system and try to just fit you into their system. And if you don't get better, this, it's just incongruent because they want you to fit the system or the program. And, we have to be honest though, like not everybody fits into the program. And that's okay. This is funny. This is the second show in a row where I've kind of done the ending and then I've talked for like 10 more minutes. I don't know what's going on with me today. Well, thank you again for your time. We will share your resources on the show notes and the blog. So if people are ever looking, you can always go to bridgetdanner.com and type in Eric's name, or, you can find it pretty easily. So you can always do that. And thanks again for your time, Dr. Osansky.
All right. Well, thanks, Bridget. Again, it was a pleasure doing this podcast interview, and I appreciate the invite.
Likewise.